As we talk about gun violence across the U.S., a new study from the American Academy of Pediatrics finds firearm deaths spiked 28% during the pandemic, while gun homicides rose 35% from 2019 to 2020. This igniting a fear in hospital workers, especially after a number of shootings have been reported at medical offices and facilities around the country. Dr. Alok Patel, ABC News medical contributor, physician at Stanford Children's Health, joins us now with more. So, doctor, we usually are coming to you on medical issues involving coronavirus, but other things as well. And now we're talking about gun violence. Do you see that as a public health issue, especially as we're seeing deaths, among young children?
Terry, I don't know how we can't view firearm deaths, wounds, and shootings as a public health catastrophe when every single day in the United States, 22 children and teens are shot, with an average of 5 dying every single day. And in 2017, firearm deaths surpassing motor vehicle accidents as a leading cause of death in children aged 1 to 19. This has to be considered a public health epidemic, because if you look at that last number, that last statistic I said, passing motor vehicle deaths, this is telling us that firearm deaths and shootings are on the rise. But also, why did motor vehicle accidents start to decline? It's because we viewed car accidents, we viewed vehicle safety from a public health standpoint, which is why there are things in place such as drinking and driving laws and seatbelts and the age to get a license. When you view something in that lens and you put forward that type of policy, you do your best to remove the politics and keep it focused on injury prevention. That's how we see progress. That's how we save lives.
That's a very interesting comparison there. I want to ask you about the shooting that took place in Tulsa against doctors. The police say the gunman in that shooting was upset because he had back pain after surgery, and he was targeting the doctor who performed it on him. How often is it that doctors receive threats, concerning threats, and how much is this contributing to what we hear about physician burnout and mental distress?
The sentiments I've been hearing from my colleagues that we've been seeing across media, not only with the sincere amount of heartbreak for these two physicians whose lives were taken, but for so many health professionals who see a lot of relatability and a lot of fear according to the situation. Terry, as you mentioned, threats against healthcare professionals in this country is an anomaly in how high it is compared to other professions. And you can look at statistics from the U.S. Department of Labor and the World Health Organization. Throughout the pandemic, so many of my colleagues, including myself, received threats, even death threats from people across the internet. Then you add that to the fact that people are burned out. There's a lot of frustrated patients making these claims, and I don't want to pin any type of blame on one specific situation. But then people are fearing this. If they live in a state such as Oklahoma that has very lax gun laws, the fact that you can buy an AR-15 in one day and walk around with open carry in a state that doesn't necessarily have a state statute against carrying it near a healthcare facility. Add all that together, Terry, and there are a lot of healthcare professionals who are not only heartbroken, but are sincerely scared. These threats have taken on a new form.
And if I could turn back to the children, I'm thinking about how hard it was for all of us to think about Uvalde, not just because of those little children's lives lost, the ones wounded, but the others, and the others around the country who watched in horror as this violence invaded childhood itself. I know someone who has reached out to the softball coach at Uvalde because 4 girls on that team were killed. And she told me, the one who's trying to help, that she thought the other girls might quit after a tragedy like this. I wonder about how mental health of children is being impacted by what we're seeing.
It's directly impacted. And we actually have studies about this in other communities where children are around gunfire. I can't even fathom what children who are survivors of mass shootings, including the brave girl who's going to talk about what it was like to play dead, the mental process needed to go through that. Terry, this falls under something that we call adverse childhood experiences, which could include anything from being a survivor of gun violence to trauma to sexual abuse to verbal abuse, anything like that. These have profound effects on a developing brain. They can lead to toxic stress, which is why it's so important to pay attention to the mental illness right now, but also ongoing in these children, and then working backwards and preventing it altogether, especially in a country where we have 400 million guns. And if we look at homes that have kids in them, 1 out of 3 have guns, which is why we stand by these protective measures such as child access prevention laws and safe gun storage and everything, to make sure that we're doing everything we can to protect children and realize the fact that when children are raised in an environment with so much violence and so much fear, it affects them in the long term.
It's terrible. It's a really disgrace in our country that children have to grow up with these kinds of fears and experiences. I want to ask about what the American Academy of Pediatricians is recommending. The pediatricians themselves now address firearm safety in the home as part of its routine care for families with children of all ages. The NRA has had its Eddie Eagle program, which has been shown to be very successful for families where guns are part of the part of the family life. What's your reaction to the AAP talking about gun safety, urging you as a pediatrician and others to talk about gun safety? And what would you say?
You know, the safest home is one without a gun, but we actually have to be realistic and realize that there are a lot of gun-owning Americans here, and many are responsible. And so it's important to have that open dialogue with families and talk about if they do have a gun in the home, if the homes that their children play at, if the homes that they visit, if there's a gun in that home, and then talk about safe storage and making sure that people understand that the safest way to store a gun is unloaded in one locked container, one safe, where the bullets are in another safe as well. And we have these conversations and there is no pushback. There are states like Florida who tried to push back against pediatricians asking these questions. And like I said, Terry, I'm proud that the American Academy of Pediatrics is taking a stance against advocacy and speaking out, in favor of assault weapon bans, red flag laws, safe storage laws, universal background checks, and more. We have to approach this as a public health issue and realize that there's two sides of this country that have to meet in the middle and have a dialogue if we're going to prevent some illness. Prevent violence and death.
And I don't want you to put on a political hat, although you can if you want, but the AAP has called on the federal government to increase funding for research into gun violence and prevention for common sense laws. What are the most important changes? Once again, not in a political sense, but what are the most important changes from your standpoint as a doctor, public health person, somebody who treats kids, that you think would keep them safer?
I think what we just mentioned with regards to universal background checks, which an overwhelming majority of Americans do support, red flag laws, even things like child access prevention laws. Terry, according to Giffords.org, over 30 states have them in place in varying forms, but there needs to be more protection in place to make sure that parents are held accountable if minors have easy access to a gun, and that we're looking at access to a gun in the same way we look at access to opioids and other narcotics, driving, these other sources of illness and injury in this pediatric age group. So I stand by that. And I'm glad that there's now funding going to firearm research. In 2019, the CDC finally got congressional funding to look at firearm research for the first time in 20 years. We have to take a step back, remove the politics, look at the actual numbers, and then pay attention to what the data shows about preventing injury. And we know that gun control laws do, even if one part of this country does not want to believe that.
What an unusual approach you have there, Doctor. The data, look at this, look at the facts and try to come up with policies based on them.
Mind-blowing.
Yeah. Dr. Patel, thanks very much as always.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.